the majority of a simple defect, those children will just grow up into adulthood. And the majority of them will live almost a normal or nearly normal life. And although some limitation might apply, for those who have a severe defect, certainly there's limitations. For those who have a more complex one, they still have to be followed regularly by the doctors. They also have an issue that might arise when they get older, especially we call a complication, they call pulmonary hypertension, which means that the blood pressure in the artery that connect the heart to the lung gets much higher than it is expected to be. And when they get this, they will have a shortness of breath, they will have get very tired, and sometimes chest pain. Okay. The other issue is infection. Those who have a heart defect is prone to infection inside the heart we call endocarditis, which means it is an infection of the lining inside the heart or the heart valve. Okay. And also almost all of them will be affected by the rhythm problem. The rhythm which is controlled by the electrical system of the heart. The more complex one will have a more complex rhythms. Okay. And they still have need a long-term follow-up, definitely the effect. But these people, we still encourage them to try to live as normal as possible. They can do the exercise, they can have activities like normal people, but there is a limitation. Those who have a simple defect, they can almost have a normal activity, normal exercise activities. But those who have a complex, we do not encourage them to have strenuous activity or competitive sport, but we encourage them to have aerobic exercise like a normal person, because we now know that exercise is very beneficial for the body. And we just try to encourage them to do exercise as they tolerate. And we do not encourage them to do a certain type of exercise that might cause straining, very straining for the heart. Let's say a weightlifting, which any kind of exercise that can cause a grunting or bear down the body's strain against the closed throat, so that they increase the strength in the arm or in the bodies, like a weightlifting. They will increase a lot of blood pressures and put a lot of strain on the heart, and also pressure inside the lung. So it's too much strain for the heart. And for the female patients, sometimes the majority of them can have a normal pregnancy, a normal healthy pregnancy. But for those who have a complex one, we have to consider with a careful consultation, because a pregnancy is put a great strain on the heart too. Before they plan to get pregnant, we need to carefully evaluate and to establish the risk and the benefit. For those who have a very complex, we try to discourage the pregnancy, because a pregnancy is dangerous for the life.